have Republican leaders given you any indication that once this vote fails, they will sit down with you and start working together?
Well, a good number of Republican members have suggested that to me and to many of my colleagues. Senator McConnell a couple of weeks ago said if their bill failed, that they would want to work with us. We hope they'll do that. The president's path, which is simply to sabotage the system and hurt millions and millions of people, make things far worse than they are today, is not an acceptable choice. And I hope our Republican colleagues will realize that.
What about, though, the idea, don't you think that both sides, even if there were these behind-the-scenes conversations for one side to work with the other, that both have to really swallow their pride? There's been such criticism on both sides, and that even though it's nice to talk about working together, but that takes a little...
There's no pride here. We want to do what's best for the American people. That's it, plain and simple. What has motivated our entire caucus and united our entire caucus was the realization that what was being proposed in Trump Care would have cost over 20 million people to lose coverage, would have made it so hard to deal with pre-existing conditions, would have made it hard for families to keep their loved ones in nursing homes. And this is not a game. We go out and talk to our constituents who this affects, and we want to help them. You know, this is not something, I think a lot of people on the other side have this ideological view that is so detached from the reality that they're removed from it. That's not us.
But that's what I'm getting at, that some of the sides are so entrenched.
We're not entrenched. We've been calling to work with our Republican colleagues. Well, we'll see. Let's find out.
Let's try.
As we know, regular order can be slow, it can be a grinding process, it can take a long time if the Obamacare exchanges are having trouble immediately. So how quickly do you think you can work?
Well, first of all, the market has been stabilizing until President Trump and some of the Republicans joining him decided to sabotage it. Had they called for cost sharing to be permanent, premiums would have stabilized and gone down, health care would have gotten better. It's not too late. They can do that tomorrow on their own. And I believe that in the Help Committee, Senator Alexander and Senator Murray could consider such a bill. I think Senator Alexander is open to it. So we could move that quickly. As for changing the health care system, it shouldn't be done quickly. It shouldn't be done behind closed doors. It shouldn't be done in the dark of night. The history of America shows when you do things in sunlight and you do things bipartisan and you do things somewhat deliberately, the result is much better than what they tried to do, which is have a small number of people in a dark room and not tell anybody else what they're doing. Yes.
Thanks so much. What guarantee do you have that the Trump administration won't stop making those cost-sharing payments?
Well, if they do, they're sabotaging the system, and it's going to rest on their shoulders. The overwhelming majority of American people know that President Trump and the Republicans are in charge. And if they sabotage the system, they will pay a huge political price. I think President Trump, in his peak, doesn't understand that. But he's actually hurting his own presidency and his own party by threatening to hurt so many people just because he wants to sort of play a political gotcha.
Where do you find common ground on questions about Planned Parenthood and abortion, those types of devices?
Look, we're not going to find common ground on everything, but we can find some common ground. Right away, we have asked for 3 rather modest things that would do a lot of good, which Amy mentioned and Martin mentioned, which is make this cost sharing, which reduces premiums and makes health care better, permanent. The insurance industry itself says nothing could do more to lower premiums and prevent premiums from going up than cost sharing. The reinsurance exchange proposed by Senators Kaine and Carper could do a lot to help make the system better. And Senator McCaskill's proposal that in Bexar counties that people get the same opportunity for health insurance as, say, we do, makes a lot of sense. Those could be done quickly and easily and avoid the kinds of ideological fights that you're talking about.
And if I could add,
Go ahead,
I know
please.
on the reinsurance issue, in addition to mentioning my own legislature and some of the legislatures across the country on the Republican side who have dealt with this on the exchanges, that Senator Collins has long been involved in this reinsurance issue. I mentioned the prescription drug issues, and I think that's ripe for discussion now. And I have a bill with Senator Grassley to stop the pay for delay. It's a very important bill to him, where companies, large pharmaceutical companies, are paying off generics to keep their products off the market. Or we have the issue of Medicare Part D negotiation that Republicans have been open to in the past. We have the issue of that Senator McCain and I have the bill for less expensive drugs from Canada. I'm not saying all of these will pass, but I'm just giving you the bills that I have. There are a number of things that are bipartisan that members have been talking about for years, but we have not had that door open, as Senator Schumer has said, to really be able to start this negotiation. So I'm hopeful that this is our moment in time. They get this vote over with, that it appears they do not have the votes to pass, and then we start.
Let's not. Go ahead, Martin.
I would just make the point that the best way to figure out which ones of those ideas actually can reach consensus between the two caucuses is to go through regular order, to have hearings, to have the kind of process that separates the wheat from the chaff, and that's what we've been missing in this entire debate.
You know, just one more point. On January 4th, the day after the first day Congress convened, the Republicans passed what's called reconciliation. That meant we don't want any Democrats involved. We wanted to be involved. But they went through this process from day one. It wasn't that they came to us and we sat down and we couldn't agree. They closed us off. They thought they could do it on their own. Now it's clear they can't. And the door is open again. And we would welcome them walking through it for the good of America. Thank you, everybody.
There are a lot of people out there today who seem to be spiking the football, trying to celebrate a moment that for now seems to leave the Affordable Care Act in place for today. But let me tell you what happens if you continue to spike the football. In the state of Colorado last week, it was announced that the average premium rate increase for the next year will be 27%. But that's if you're lucky enough to live in the Front Range of Colorado. If you live in the Eastern Plains, the Western Slope, you're going to pay 30% more. You're going to pay 40% more. That's spiking the football on the American people who will continue to pay more under the Affordable Care Act that is collapsing. We will continue our work to get our job done to make sure that the status quo no longer stands, and instead we provide relief to the American people.
Yeah. You went through 2 iterations of your bill. We've heard from some of your members. They were very critical of the process. Some were critical of you. Senator Johnson was specifically critical, said there was a breach of trust. Do you feel that you and your leadership have been damaged in this process, and that now you can actually usher this across, considering those criticisms of you that you've heard?
Well, you know, this has been a very, very challenging experience for all of us. It's pretty obvious that we don't have 50 members who can agree on a replacement. A lot of people have been involved in the discussions, been very passionate discussions, but everybody's given it their best shot. And as of today, we just simply do not have 50 senators who can agree on what ought to replace the existing law. What we do have is a vote that many of us made 2 years ago at a time when the President of the United States would not sign the legislation that would repeal Obamacare, and with a 2-year delay, give us an opportunity to build something better on a bipartisan basis. That's what I sense most of our members would like to vote on now, and we'll be doing that in the near future.
But it seems like some of them have been.
Nancy?
You don't appear currently to have the votes for that repeal plan. So if that vote fails, do you then begin working with Democrats?
Well, I think we'll have to see what happens. We will have demonstrated that Republicans by themselves are not prepared at this particular point to do a replacement. And that doesn't mean the problems all go away. And you'll have to look at our committee chairmen and their ranking members. My suspicion is there'll be hearings about the crisis that we have, and we'll have to see what the way forward is.
Senator McCall, you've been promising this to your voters for the past 7 years. You said that you would do this year. These 7 months essentially wasted with no accomplishment. How are we going to explain this to voters next year if we don't do what you campaigned on?
Well, we have a new Supreme Court justice. We have 14 repeals of regulations, and we're only 6 months into it. Last time I looked, Congress goes on for 2 years. We'll be moving on to comprehensive tax reform and to infrastructure. There's much work left to be done for the American people, and we're ready to tackle it. Thanks.